Fracture is seen when a 22 years old drunk man is involved in fight and injuries in his thumb when they punch the opponent. So it is very obvious that a 22 years old man who was drunk and involved in fight, and he hit by a punch of his hand. What type of the fracture it is? Here the options are Barton's, Bennett, Galeazzi, Collis, Smith fracture. So first of all, see this fracture. This is a fracture which involve the first metacarpal. This is the first metacarpal. So when this is the first metacarpal, and this type of injury occurs when there is the boxing or this type, that means the punch, after punch the injury, and this is the fracture of the first metacarpal bone. So in the thumb there is the first metacarpal bone which it is fracture, and the mechanism of injury is by the punch or the by the hand hitting any area in this condition. And here we can see a muscle present, which is the abductor pollicis longus tendon. They are present on the base of the first metacarpal. So the Bennett fracture, this type of fracture is usually known as the Bennett fracture. So the Bennett fracture, it is the fracture or dislocation, the proximal end of the first metacarpal and metacarpophalangeal or carpometacarpal joint. It is an articular fracture. That means usually it involves the articular surface, and it occurs due to axial compression, due to punching. So this point is very, very important. It is the boxing with a closed fist. So in case of boxing or punching, this type of injury occurs. So it is the pain swelling are localized. That means pain swelling occurs in this area also. And what is the treatment? Treatment is the immobilization for the 4 weeks, and usually by the thumb spica splint. This is the another picture, and here we are showing the Bennett fracture, which is the fracture of the first metacarpophalangeal of the first metacarpal base, and also it is the involvement of the articular surface. So it is intra-articular fracture. That means it involves the intra-articular fracture. It involves the first metacarpophalangeal joint, first carpometacarpal joint, or that means the base of the first metacarpal, and it is impact due to flexed metacarpal caused by the fist fight. And X-ray occurs. These are the triangular fragment usually present. So what is our answer? It is the Bennett fracture. Why Bennett fracture? Because the Bennett fracture occurs due to mechanism of the punch of the opponent in a closed fist. And other option here, such as the Barton fracture. The Barton fracture is one type of the Collis fracture or Smith fracture. The Collis fracture and Smith fracture, they are the distal radial fracture. In case of Smith fracture, there is the volar displacement and spot deformity occur. In case of Collis, the reverse Smith occurs. And the Barton is the Collis fracture or Smith fracture. When Collis or Smith, they are involvement of the articular surface or joint surface, then it is called the Barton fracture. And what is the Galeazzi fracture? It is a fracture of the radius with dislocation of the distal radioulnar joint. So I think it is now clear all 5 type of the fracture here. First of all, the Barton is the Collis or Smith fracture with articular involvement. Galeazzi, it is the fracture of the radius with distal radioulnar joint dislocation. Collis and Smith, they are the distal radial fracture.